Hi, welcome to my hip pain page. Remember, these videos are for informational purposes only. They do not substitute an actual evaluation or treatment here at Dr. D's Physical Therapy. And as always, you want to consult your physician before trying a new exercise routine. So for this one, we're going to actually start on our backs. And we're going to do a couple of rotations of the hip. And this just allows us to get some nice, good synovial fluid going in our hips that will make them feel nice and juicy as we do these exercises. So first, I know you just saw me correct my posture. You want to go into that neutral position. We're going to start by rocking the hips forward and then going back. And then we're going to stop right in between to have a neutral spinal position. We're going to bring our knees up so that our knees and our feet are together, and we're just going to do some circles here, okay? This is a nice way to warm up the hips. Maybe having both legs up at the same time is too much, so you can leave one down and then just go around in a circle one at a time. Okay, and then we'll go over to the other side. But my preference for this exercise is to be here and then go around. It just feels more coordinated. And you don't have to go super fast. Just go at your own pace and what feels comfortable. If anything feels pinchy or you don't like it, then you just don't do it. All right. The next thing we are going to do is called a 90-90 stretch or range of motion. So 90-90 because we have 90 degrees at the hips and at the knees. I'm going to make my arms out like a T. I'm going to bring both legs over to the left and then over to the right. I love this exercise because it offers nice, good mobility, but you get a nice opening of the hip flexors on this side here. And you know, we all spend a lot of time in chairs or sitting in traffic, and it's just nice to open up the hips, okay? So we want to try not to arch our back or anything like that. Maintain contact of the floor with your shoulder blades. Okay, and then the last one we're going to do is going to be is called a piriformis or figure 4 stretch. So we're going to start back with our knees up. Go ahead and fix the posture. We're going to take our left knee and bend it. Put your left heel on top of your right knee. We're going to take our hands, we're going to interlace our hands behind the crook of the knee. I'm going to bring my foot down just a little bit. And then I'm just going to do a gentle pull. Ooh, wee, my left hip is tight. This feels really good. So just like I informed you in some previous videos, for our stretches, we want to hold for what? That's right, 30 seconds, repeat it 3 times. For this stretch now, so at first I had like pretty moderate discomfort, but now it has settled down a little bit. My left hip is my tighter hip for this exercise, but maybe you're more flexible and you don't feel a whole lot of stretch here. You could always take your right hand, place it on the shin to pull back a little bit more. Take the left hand, push down on your knee, ooh, and you get a little bit of extra stretch for the outside of your hip. That feels really good, okay? So I think we've been holding this one more than 30 seconds, so we're just gonna gently put our foot down. And you can stretch it out if you need to. And then we'll come back here and do the same thing again. Hold for 30 seconds. I did feel it better personally, like this. Ooh. That feels really good. All right, so again, 3 times, 30 seconds on each side. For this one, for this video, I'm gonna go ahead and switch and go over to the other side. Okay, all right, so now we are going to take our right knee, Bend, put your right foot on top of the left knee. So you see how it's a figure 4. We're going to lift the legs up, interlace underneath the thigh, and pull here. So this one I have to really pull. I can feel it here. So whenever you're stretching, you're always looking for a stretch discomfort. It should not be a sharp pain, but it should be moderately uncomfortable because you are moving your muscles in a position that they don't necessarily get into a lot in order to stretch. And in order to improve the length of the muscle, you have to hold it for 30 seconds. You got to do it 3 times. Believe it or not, you got to do it at least 5 days a week. Would be the most beneficial. I'm going to go ahead and press on this knee a little bit to get a better stretch. Okay, I think that was about 30 seconds. When I'm doing these stretches on my own, I typically set a timer for 30 seconds. That's what I advise my patients to do also, to make sure that we're getting that nice 30 seconds of stretching, because that's how we improve our flexibility. And the more flexible your hips are, the more you can squat down to do any of your activities of daily living or help out a loved one. So having nice flexibility in the hips is invaluable, especially as you get older. Okay. All right. And again, to get out of this position, we want to roll over to the side instead of springing up, and then push up with our arms. All right, so if you are experiencing hip pain, please give us a call. We can discuss your symptoms further and set you up with an evaluation, evaluate your hips, and see what's the best way to help you feel better.